Dr. Coletti, Baywest Health and Rehab today. It is early January. Happy New Year, if I've not mentioned that to you yet. But today we're going to do a Manipuflex procedure on a longtime patient of mine who suffered for years discomfort in his neck and his upper back. He's got multiple disc injuries and degeneration in his spine. And we've done that Manipuflex procedure just once, I believe. Probably about 2.5 weeks ago. And I'll let him tell you, Steve, your first Manipuflex procedure, what was your, having been to a chiropractor and seen us for a number of years, and then having that procedure, what's your take on that?
Well, I started getting headaches, and it actually relieved a lot of tension that I was having. I actually felt better for over a week, and maybe longer.
And that's longer than you typically get the results from a typical adjustment.
Right, because it was like extra pulling on it and it worked great.
Well, today we're about to do Manipuflex number 2 on Mr. Steve, and he's going to notice a big difference because typically when I do this procedure on a new patient, the first time it's about breaking open those adhesions from the skull, head, all the way down. Today, we're going to get some cracking. Let me get your face down, Steve. And I always start off my patients through this procedure as long as there are no contraindications with regards to opening up the spine and the back. This is a Flexion distraction spinal decompression table. I always strap what's comfortable in the chest. Is that okay, Steve?
That's good.
I'm going to lock in the legs. I get a lot of comments like, oh, this must be the rack, whatever the rack is, I don't know. But I lock it in. I'm going to distract. And we're going to start. And we're going to open up the spine a little bit. How's that feel, Steve? Okay?
Great.
Steve, how old are you or how young are you?
60 levels.
60 levels?
Yeah.
Well, Steve is in his early 60s, and you know, there is an age limit, or what I would call a degenerative limit, with regards to what type of patients can receive a Manipuflex procedure, and a lot goes into that. I know Steve, I know his spine, I've been treating him for a number of years. He can handle it, and which is why we're going to see today he's going to get a lot more relief, because upon the first visit, or upon the first actual traction Manipuflex maneuver, let's just say I don't overdo it, okay? As a disclaimer, I know my patients, okay? I'm very confident in what I do. If you're not, don't try this at home.
Well, it's also been 7 years.
7 years, is that how long I've been treating you?
Yes, it is.
And I always will take my hand and place it upon the mid to lower back region and really open up the paraspinals there with a little lateral flexion. Breathe through the nose, Steve. Through the nose. Out the mouth. Every inhale, take it in. Every exhale, let every bit of toxin, every bit of discomfort, soreness, let it go. Let it go. There you go. Okay. I get a lot of comments and remarks from other doctors on, you know, can you do this procedure on patients with active disc injuries? And you know, absolutely you can. Yes, and every day and twice on Sunday if you want. Again, as long as you're confident in the actual patient, confident in not only their age but their level of degeneration, because I've seen, as I'm sure many of you docs out there have seen, you know, there's some 40-year-olds with 70-year-old spines and vice versa. You know, it's all who has taken care of their spine. Relax. Yeah. That doesn't bother you at all in the front of your leg, does it?
No.
You're a good liar on film. I appreciate that.
I am.
Loose, 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 loose. Relax. Okay. Relax, loose, loose, all the way. Good. Loose, loose, and loose. Breathe out. Good. little hip distraction. We're going to this table has a lot of elevation. Typically that's really for me because I'm a little taller and it saves my back. Okay, we're gonna. Now I'm gonna stabilize the pelvis, balance the pelvis. Relax. Loose, loose, loose. Breathe. Breathe in, let it go. Relax. Loose, loose. All right, Steve, arms to the floor. I want you to breathe in. Hold your breath, hold your breath, hold your breath. Breathe in more. Hold it, and let go. All the way. Good, more. Good. And let it go. Good. I think I get sometimes as much relief and release as the patients do. Breathing is so important. Relax. Breathe in. Let it go. Good. Good. Okay. We are going to get you to flip over on your back, Steve. Now, for those of you who have not seen, I'm going to reiterate. We raise the legs up with just a simple wedge. And this is something that I've watched and learned from I call him the Godfather, Dr. Johnson, and his ring dinger in Houston, Texas. I utilize straps. Patients seem to find great comfort in that. It just stabilizes the pelvis. The wedge that you see here helps to flatten out the lordosis of the spine so that when we traction his neck and upper back, he's not going to come flying off the table. Dave, is this too tight or is this okay?
No, fine.
Good. Hands, tuck them under your bottom all the way. Allows the shoulders to sink. I utilize a warm towel that we keep in a designated hydroculator, which is very, very hot. Lift your head and down. Good. Relax, relax. Is that too warm?
Perfect.
Good answer. And just let them shoulders sink, settle, loose, loose, loose. And before I jump into this actual procedure, I'm just going to stretch a little bit, let your head relax. And we're going to stretch the neck, loose, loose, chin to the chest. Breathe for me. Good. Relax. And relax. Keep those hands tucked under your bottom, okay? And relax. That warmth feels pretty darn good, huh?
Yeah, it sure does. I can go to sleep with that.
Okay. And I want you to just relax. Okay. And loose. And let it fall. Breathe. Let it go. Exhale all the way. Let it relax. Good. More. Good. Ah. How do you feel?
Great.
That's called Yahtzee.
That's awesome.
Give me a thumbs up, Steve.
Perfect.
Another Manipuflex. Say goodbye to those, whatever they were, headaches, everything.
They're gone.
Dr. Coletti, Baywest, I am out.